আসসালামু আলাইকুম। আমি সানজিদা বাংলা হেলথ কানেক্ট ইন্টারন্যাশনাল থেকে। আজকে আমাদের সাথে আছে ডক্টর কর্নাড কোশিগেন, যিনি বাংলাদেশে অনেক ফেমাস, অনেক পেশেন্টের খুবই পরিচিত, খুবই পছন্দের একজন ডক্টর। তো আমরা আমাদের সাথে আজকে ডক্টর কর্নাড কোশিগানকে পেয়েছি। আমরা আজকে ডক্টর কর্নাড কোশিগানের সম্পর্কে জানবো। অ্যাজ এ ডক্টর আমরা জানি যে ডক্টর কোশিগান কেমন। তো অ্যাজ এ পার্সন উনি কি ডক্টর কোশিগান কীরকম, আমরা সেই ব্যাপারে আজকে কিছু তথ্য ডক্টরের কাছ থেকে জেনে নিব। তো যাতে কোনো কোশ্চেনে ভুল না হয়, যার কারণে আমি একটা লিস্ট প্রিপেয়ার করেছি, এ বিগ লিস্ট অফ কোশ্চেন। সো আমি আপনাদের সাথে আগে শেয়ার করে নিচ্ছি যে কী কী কোশ্চেন আমরা আজকে ডক্টরের কাছ থেকে জানবো। প্রথমে আমরা জানতে চাচ্ছিলাম ডক্টরের কাছ থেকে যে ডক্টর এই প্রফেশনে কতদিন যাবত আছেন, কত বছর যাবত আছেন। তারপর যেহেতু উনি অনেক বাংলাদেশের পেশেন্ট উনি হ্যান্ডেল করেছেন এখন পর্যন্ত, বাংলাদেশেও খুব আশা হয়েছে। তো বাংলাদেশের ব্যাপারে ডক্টর কী পছন্দ করেন, বাংলাদেশের কোন খাবার পছন্দ করেন। তারপর আমরা জানি যে ডক্টর অনেকগুলো সার্জারি কেসেস হ্যান্ডেল করেছে, তো কতটা কেস হ্যান্ডেল করা হয়েছে এখন পর্যন্ত। তারপর কতগুলো রিপ্লেসমেন্ট কেস, লাইক নি রিপ্লেসমেন্ট, হিপ রিপ্লেসমেন্ট, এইরকম কতগুলো কেসেস হ্যান্ডেল করা হয়েছে। আর খুব কমন একটা কোশ্চেন থাকে যে রিপ্লেসমেন্টে কোন ইমপ্ল্যান্টটা ইউজ করা হয়। তো এই খুঁটিনাটি কোশ্চেনগুলো আমরা ডক্টরের কাছ থেকে আজকে জেনে নিব। হ্যালো ডক্টর।
Hello.
So, as you know, we are getting lot of patient of yours, and you are very famous to our Bangladeshi patient. So I'm gonna ask you some basic questions about Bangladeshi patient, how uh, how much you are liking about our country, our people. So I have prepared one list of questions. So I'm gonna ask you these questions. So in this profession, how long have you been working as an orthopedic surgeon?
Now I entered into orthopedics in 1995, so that would make it around 27 years into orthopedics as a specialist. And I've been a consultant for more than 16 years, and currently I'm based at Chennai Apollo Hospital as a specialist in joint replacement, arthroscopy and trauma surgery. And I'm also currently the head of the department at the Chennai Apollo Hospital. So close to 27 years in orthopedics itself.
27 years, okay. So doctor, how many surgeries have you done so far?
Well, I would say roughly, if you put it at about 400 to 500 per year, that will bring to more than 10,000 surgeries in orthopedics.
Okay.
A vast majority of that would be fracture-related surgeries, joint replacement, and sports injury-related surgery, what we call keyhole surgery.
Okay. So what are the common treatment people from Bangladesh are getting from you?
We have a mixed bag really, and mostly it is people who have already had some treatment for the injuries here by the doctors, and sometimes it's not gone well. Sometimes it is the sports related injuries like knee ligament or shoulder injuries, and of course the common thing is back pain and joint pain. Joint pain is arthritis which comes with the aging, and sometimes it's also arthritis following injury. What I found also in terms of joint related problems here and also the northeastern part of India, there is a significant number of what we call the inflammatory type of joint problems. Commonly it is called as rheumatoid problem. They themselves sometimes come out with reports saying the doctors have suggested that I have got a rheumatoid. Ankylosing spondylitis is another condition which I think there's a wide prevalence in this part of the world and also in the northeastern part of India. So essentially fractures, fracture related complications, joint and back problems.
Okay, so can you tell us about some complicated cases that you have handled from Bangladesh?
Quite a few actually, and because I think a lot of them get treated for their other common problems here, and in fact, the ones which come to Chennai Apollo in particular, because it was the first of the Apollo, as you may be aware, is more than 37 years now. It was one of the first orthopedic uh, hospital, private corporate hospitals to deal with the orthopedic problems. So they do come with sometimes a problem which has been there for a long time,
Okay.
and they were waiting for it to be get treated coming to India. Or sometimes they've already had some procedure which has not gone well, as I told you, either with fracture or joint replacement surgery, or the deformity of the limb, the knee or the hip or shoulders and elbow was so bad they would want to take treatment from Chennai Apollo in particular. There's also been few tumor cases
Okay.
which are actually proven to be cancer or cancer-like growths affecting actually younger people in the middle age or under 30s who actually have been advised they may need amputation or removal of the affected part, where we have been able to save that by what we call salvage surgery, that remove the tumor and then reconstruct the affected part with another part of their own body or with custom made implant along with the plastic surgeons. So some of those even we thought we may not be able to save that limb because of the age. We didn't want to go for removal of the limb as the first option, and fortunately God's grace and patients excellent cooperation, they're doing well. And of course I am a redo surgeon, meaning revision hip and knee surgeon, where it, the joint has already been done, it is failed because of infection or it's failed over a period of time. So we remove what is already there, clean up the old joint, and then do a revision hip or knee surgery. When it's infection, it becomes a challenge. I may have to do it in stages, but again, most of them are going to be successful, giving them back the quality of life, being able to do their day-to-day function.
Okay. So as you said that you have done so many replacement cases as well. So how many replacement cases have you done so far?
When I said more than 10,000, that mostly would have been joints.
Okay.
Trauma is very common, particularly my earlier days in England was mostly trauma, and then towards the end, where I subspecialized into more into joints and keyhole surgery, there were more of joints and keyhole surgery. So I would say more than 15,000 surgeries, and vast majority of that would be joints and keyhole surgery of the knee and shoulders. And again, the training in England is you go through various subspecialty. As a trainee, you get to spend time in shoulders, hips, knees, spine, feet, pediatrics, tumor, and you have to rotate through all of that to finally be eligible to register in the UK General Medical Council. So I've had the opportunity to replace almost all the joints, including the finger joints. When I was working with a hand surgeon, the rheumatoid patients have mostly the small joints affected, small joints of the feet and the hand. And I've had the opportunity to do even replacement of the finger joints and hip, knee, ankle, shoulders. However, the most common ones across the world is the hips and knees, because they are big joints, they're weight-bearing joints, and of course shoulder is also becoming more common with injuries as well as the increasing diabetic population across the world.
So we are asking a very common question from the patient that what kind of implants are you using in these cases? So what is your recommendation?
Yes, well, patients from here, they do ask that question also. Now, with regards to the knee and the hips, one of the main aspects the patient wants to know is whether they can do namaz,
Yes.
because that's a religious requirement. So, one reason for the so-called high flexion knees to have come on the market is because of the Middle East and other areas of the world where this requirement was there. So we do have something called the high flexion knees, and the same holds good for the hips. Now, without bending the hip, you cannot bend the knee. So, one of the dreaded complications of hip replacement is the ball coming out of the socket, a dislocation. Even in the US, if you take it, it's around 2 to 3%. So, when you want to allow them to take such extreme movements, now for walking, climbing, and for most activities, the standard, what we call the standard hip replacements are okay. But I do something for last more than 6-7 years, and with extreme patient satisfaction, from particularly from this patient from this part of the world, from this country, is the dual mobility hip replacement. I, in simple terms, explain to them saying it's a double ball, double socket. Uh, Basically, our natural ball and socket is quite a big ball and big socket. And for many years, what we're doing was a smaller sized ball and a socket. That because material were not so good at the time to take a big ball and big socket. The fear was it may wear out. But with the technological advancement, we now have materials which can last for 25 years or 30 years, and we are able to replace the hip with what we call almost their natural hip size. And the double ball, double sockets, the dislocation rates for me almost for the last 6 years has been nil. And previously, I must say, probably one or two over a few hundreds. And because I put for some of these patients, those patients tell by word of mouth to someone else, and in fact the request is coming as they come in to see me there. They do ask this question, and then I have a model there of the ball and socket, so I give them the choice, because there may be a cost variation. Pain wise, they will all do well, but stability wise, the dual mobility is a more advanced design, and currently that's the most advanced design which is available in the States as well. And we also have a new introduction now, which is the robotic joint replacement surgery. Uh, we at Chennai is among the first in the Apollo group of hospitals to have got both CT-based navigation and robotic to get this joint replacement more precise. Now we work on certain angles and implanting this in the most accurate position as possible, so that they last long as well as they remain stable. So over the past 6 months or so, we've already done more than 300 robotic knee replacement and some hip replacements. And again, people, with so much out there in the media for people to read, and they come well informed, and sometimes they request for robotic joints as well. So we do now have, in addition to the conventional hips and knee replacements, a robotic CT-based navigation assisted and robotic assisted joint replacement.
I will not ask further more question regarding the medical things. I think এই কোশ্চেনের আনসারগুলো আমাদের পেশেন্টদের জন্য খুবই হেল্পফুল হবে, যাদের এই প্রশ্নের জানার খুব থাকে যে কীরকম ট্রিটমেন্ট হতে পারে, কী প্রসিজার হতে পারে, ডক্টর কোশিগানের কাছে গেলে আমরা কীরকম ট্রিটমেন্ট পেতে পারি। তো আশা করছি ওগুলোর রিপ্লাই আমরা পেয়ে গেছি। তো নাও I would like to ask some question about as you handle many Bangladeshi patients and you visited Bangladesh several times. So what do you like about Bangladesh?
To be honest, if you were to start, I would say the food. but
Okay.
I'm a foodie. But yes, we do have a lot of cultural similarities. I think it's our neighboring country. Uh, Both in India and Bangladesh and the neighboring countries, there is always still a respect for doctors, which they have, because they do see us doctors as someone who's saving their life or giving them back the quality of life, and that trust the Bangladeshi patients have, particularly in our Chennai Apollo, I think is humongous, and that makes us spend more time with them, give them the choice of treatment they're looking for, and uh, and the every time I visit there, I feel it is one of the most improved country in terms of economy, and also the infrastructure is improving. Uh, I think rightly in few magazines, particularly during this pandemic, I think they've been credited with handling the pandemic quite well, and some of uh, the business magazines have put Bangladesh high on the map in terms of growth and development. So I think they're heading in the right direction.
Thank you, doctor. So, as you said, you like Bangladeshi food. So, what food do you like most in Bangladesh?
I think most of them are good, and my taste of Bangladeshi food was not necessarily when I traveled to Dhaka, Chittagong. And when I was in England, and there were these dopiasas and buna and jalfresis, and I never heard of them in India much, or I've never eaten much out in India. And then I realized actually most of these restaurants are actually run by Bangladeshi chefs, and the dal is very good. Uh, Even when we are having non-veg or roti or rice, there's always a bowl of dal which goes with almost everything. And the other aspect is the freshness. I think it's not very spicy. I found the food is quite fresh, or it's freshly made. Even I've had it in small outlet. I've had there in big restaurants as well. I think it's mostly freshly done, and some of the fruits, particularly the certain types of mangoes, is very good. We do have a lot of mangoes, variety of mangoes here, and so I think yes. And in the last few times I've been there, there is increasing number of other cuisines as well, continental, Italian. I see them, quite a few of them coming. Some of the best fish restaurant I've been in the world, and also Italian, actually are in Dhaka or Chittagong. So I think there's a lot of them. And yes, I can't forget the special type of biryani they have, the Fakhruddin biryani. I was reading how it's being done. It's a different one. Again, in India we have so many types of biryani, from Punjabi to Hyderabadi to this thing, and but this is something unique, and they do have a small snippet about how it's being done, and so yes, many of them indeed.
So, doctor, so what do you like about Bangladeshi patient? As every day you are seeing a lot of Bangladeshi patients.
Yes, over the years there is more number of people coming here, and I think first of all they give you the confidence by the amount of trust they place in at our Chennai Apollo. They have huge confidence in our skills and the way we approach them. That motivates us to actually give more to them. One of the things which I've told my other colleagues also is the way they keep the record keeping. I think is actually needs to be commended, because they do have separate files. They would have seen cardiology, they would have seen urology or orthopedics in Bangladesh, but they maintain the file in a very chronological order. So at any time you ask them, do they already have a report, or you write a medicine, and they sometimes help you with saying a few months ago or a couple of years ago it was done or this was given. So that actually helps us in taking decisions as to what would be the next appropriate management. So the medical record keeping actually is quite commendable. I don't think our own patients here maintain so well. Some of them do. And now they come from various socioeconomic, you know, socioeconomic background. But I must say, their level of understanding has been quite impressive. Because sometimes I used to think, am I going in too much in detail or depth in trying to explain to them what I'm going to do? But actually, they do exhibit a reasonable level of understanding. And now some of them are farmers, or some of them are in white-collar job. But that is also something I've noted in patients from Bangladesh. They're reasonably well informed because they're coming here for sometimes second or third opinion, and their understanding capacity is quite good. And keeping the medical records in a very chronological order in a well-filed system, again, is quite impressive.
So, doctor, would you like to give some suggestion to your patient?
Yes, because one of the common things we find sometimes when they come here is they come all the way, and sometimes they're not able to take the treatment suggested in the same visit, and they have to go back, and then they have to come back here. It's a lot of logistics and cost and time, and also for certain cases they're delaying the treatment. Now that is why with our excellent teleconsultation facilities, they do have the opportunity now to use that, so that they can have the initial consultation or inquiry through email or a teleconsultation. At least 70-80% of the diagnosis can be made and a treatment plan can be made, so they can avoid one more additional unnecessary travel here, because it's cost and their time. Someone has to accompany them, and yes, in the past these teleconsultation facilities were not that well established. Now we have a very good networking setup, and I think that may be way forward. And because some of the investigations they've already done in Bangladesh, and they come all the way sometimes just to show that and take the treatment plan. So that is something I would suggest to them, is if they're planning to come there, if it's emergency, yes, they come straight away. If not, they can use the teleconsultation facility to come more prepared, and when they come, take the treatment and then go.
Thank you so much for your valuable time, doctor. তো আশা করছি আমরা মোটামুটি অনেক কিছু ডক্টরের কাছ থেকে আজকে জানতে পেরেছি। আর ডক্টর যেটা বলছেন যে সময় এবং খরচ বাঁচানোর জন্য আমরা চেন্নাই যাওয়ার আগে অবশ্যই একবার টেলিকনসালটেশন করে নিতে পারছি। তো টেলিকনসালটেশনের ব্যাপারে ফার্দার মোর জানতে আপনারা আমাদের সাথে কানেক্ট হতে পারেন। তো আজকের জন্য এতটুকুই। আমরা নেক্সট টাইম অ্যানাদার ডক্টরের সাথে কানেক্ট হব। থ্যাংক ইউ সো মাচ ফর ওয়াচিং আওয়ার ভিডিও। আসসালামু আলাইকুম।